Hello, my name is Dr. Alyssa Gum, and I am the Addiction Medicine Fellowship Program Director. And we collaborate amongst 3 different facilities, which are University of Arizona, Banner Health, and the Southern Arizona VA healthcare system. When you attend our fellowship, you do a lot of your work here at the VA. We do about 4 months here on property on our inpatient unit, and that inpatient unit takes care of detox patients. And we also collaborate with our inpatient teams on the consult liaison service, as well in the emergency department. Also located on the grounds is a residential rehab program up to 6 weeks, and currently is taking 13 patients and has the capacity to go to 26 once we're out of the pandemic. As part of your rotations here at Sava Hicks, you will be a part of an integrative team, and this right here is our updated resident room. So as the fellow, you take lead on educating both trainees from our psychiatric department, our family medicine department, and also our emergency room department. And you have different levels of trainees from interns to PGY 3s and 4s, all rotating through the service. Not only do we have postgraduates, but we also have medical students that come through and rotate with us. As part of their psychiatric rotation, they do 2 weeks of addiction medicine training, and so they'll be a part of the team too. As sometimes we have anywhere between 2, 3, and 4 trainees with us learning the importance of addiction medicine. And we all are collaborative, working together alongside each other. In this room, there's another room, and we're right next to our inpatient facilities. There's not a whole lot of walking. We're right connected with everything. And right outside of this is also my office. So if you ever need me, you just come and grab me. And so we're just a very big team here, and we love working with each other.
Hi, my name is Jamie Weinand. I'm one of the Addiction Medicine Fellows here at the University of Arizona Tucson program. I chose the Tucson University of Arizona Addiction Medicine Fellowship program because I'm a Tucson, Arizona native. I know that Tucson is a wonderful place to live. It's 365 days of warm, sunny weather, and there's certainly a lot to do here. It's a really diverse community, and we're lucky that we have the Southern Arizona VA healthcare system here. So part of our fellowship is working here at the Tucson VA. It's a really excellent resourced VA. We have a lot of opportunities for patients and people with addiction, whether that's residential treatment, IOP, even domiciliary programs in the Arizona area for people. We have a robust outpatient buprenorphine clinic, as well as we treat all substance use disorders in our outpatient clinic. The other great part about Arizona, of course, is the University of Arizona. So our fellowship is affiliated with both the VA and the University of Arizona. We have a robust consult service at the University of Arizona Main and South Campus locations. So we are able to see a lot of variety, whether that's treating someone's opiate use disorder and being consulted when they are admitted for intravenous drug use with associated endocarditis or bacteremia. We're able to really be that extra piece of the patient's medical care to kind of get a holistic care of all of the reasons why they're in the hospital. In terms of the fellowship, it's a 1-year program, and we have excellent faculty in multiple sites where we rotate at. I chose to treat addiction because I think it's an issue that as a family doctor I would see constantly in the clinic, and it's a very treatable condition in many ways depending on the substance use disorder, and yet many people are sort of afraid or feel that they need more training to really attack these issues. So for example, with opiate use disorder, the medication of buprenorphine naloxone is somewhat underprescribed. We know that opiate use disorder has a relapse rate of about 90%, and buprenorphine medication can bring that down to about 50%. So if we had a medication that was that effective for any other condition like diabetes, heart failure, or hypertension, a family doctor would not hesitate to use that at all. And yet we still see a lot of hesitation to prescribe buprenorphine. So really gaining that comfort level over the last year has been extremely helpful. And I know that moving on to practicing medicine in Tucson, Arizona, being a part of the fellowship is really going to make me a much better doctor.
Of course, you don't do all of your training here at the VA. We do a lot of community clinics as well. So we work in our Kodak clinic, which is a community or Medicare-based and Medicaid-based clinic, which provides opiate treatment programming. We also work with the Paschal Yaqui tribe and provide an addiction medicine clinic to their population as well. We also work with Banner Health in providing a consult liaison service, and we do some private rehabilitation programs such as Imbalance, which is an adolescent rehab program as well as Sierra Tucson, which is an adult private rehab program. So we have access to a full complement of different training sites and a wide range of ages from adolescents to geriatric.
What to do in Tucson? Tucson is home to the University of Arizona. If you're into college sports, the university has 21 athletic programs with Wildcats playing many different sports to watch. This mid-sized city offers big city amenities with a smaller town feel. Tucson offers mountains in every direction. You're quite literally surrounded by 5 minor ranges of mountains. With 350 days of sunshine a year, Tucson offers fantastic weather, national parks, forests, and deserts, providing the perfect environment for tons of outdoor activities such as golfing, rock climbing, bird watching, astronomy, and cave exploration. Tucson is a biking paradise. The city has won numerous awards when it comes to biking. You can also find great hiking trails within the city limits. After all the outdoor activities, you'll be happy to know Tucson has a huge variety of restaurants. The various downtown Tucson restaurants each offer unique atmospheres and span the gamut with food choices.
No matter what you're into, we probably got it here in Tucson.